In this video, let's talk about hip pain that's caused by your hip flexor muscles. Hi, welcome back. This is Wei, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness and performance. So if you don't miss any videos that I post over here, don't forget to subscribe, don't forget to hit the bell button, because this way YouTube will notify you whenever I post a video. Right. In this video, we're going to share what actually are your hip flexor muscles and how you can actually locate them, how you can actually palpate them, and whether you're actually looking at the right muscles that we are talking about over here. Okay, so we're gonna go through with the 3D model as usual. You can better understand what are the different muscles over there, and when you palpate and when you feel it on yourself, you can then know, okay, this part is this muscle and this part is this muscle, where is the landmark, and that will help you find those muscles if you know that there's something wrong over there. Okay, so let's not waste time, let's begin. Now over here is the anatomy from the front perspective of your hip. So what we want to talk about is, or rather, are your hip flexor group muscles. It's not one muscle, basically there are a few of them. Okay, so let me just remove some of the muscles so that you can see them. The original hip flexor group muscles are basically the muscles that actually flex your hip. So when we talk about flexing your hip, the action that does that movement basically gets the muscles to contract. So let me just remove a few more things over here. Right. So when we talk about muscle contracting that pulls your femur bone up, it's basically this group of muscle. And a lot of times you will hear this term called iliopsoas muscle. And it's basically a combination of the psoas muscle and the iliacus muscle. Okay, so they are two separate muscles, but they're usually grouped together and it's called the iliopsoas, and they originate from different parts of your body, and it basically attaches to your femur bone over here. So when they contract, they're actually shortening and they're actually pulling your femur, or they're rather flexing your hip. Okay, so these are the two muscles, and if we were to bring in some more muscles, and if you just take a look at it, because they are so close and they are so I would say, because of its position, it may come in as a hip flexor muscle as well. And this is the next one, which is called the pectineus. Most people don't talk about it, but again, if you talk about the muscle shortening, you can't say that this guy is not flexing your hip. Try flexing your hip and put your finger where the muscles are. You will realize that there's no way the muscles there's no way that you can try to avoid the muscles from being working, and hence compensation come in when you have no control, because that's how your body wants to function. Most people only talk about the by right kind of issue where the muscles are supposed to work this way, but when it comes to real life, when it comes to a practical function, there's no way that you can control. And when the muscles want to come in and work, this is where you want to find out why, and it's because they're so close. Once these guys stop working, or rather you have maxed out the capacity, or if the load is just too much, some other muscles will come in and do the work. Alright, so let's bring in more muscles, and from here you will see that the quadriceps muscles are starting to come in. Right, so this part of the quadriceps muscles usually don't get into the hip flexor kind of work, but again, they will try to come in and help if the load is too much. Okay, so a lot of times the hip flexor group muscles becomes this group of muscles over here, because sometimes you have no control, right? The next muscle that it's coming in is basically that next guy that is actually or rather the next few guys, the next few muscles are actually coming in to help your hip flexor, because you can see that the muscles are actually on your hip. This is where the muscle originates. This is your sartorius muscle, and it runs diagonally to the medial side of the knee. Okay, and the other one is basically part of your quadriceps muscle. It's actually your rectus femoris, and this guy basically runs from your hip and all the way down to your knee. Okay, and this is the guy that cannot escape when you try to do a hip flexion movement, because once you reach a certain angle, this guy has no choice but to come in and do the work. So when we talk about hip flexor group muscle, this area is basically working to make sure that you can pull this bone upwards, or in many areas that you will see, we talk about hip flexion, which is holding this bone upwards, right? So these muscles are basically those guys that's actually involved, because to move this bone upwards, you have to be attached to somewhere else so that they will do the pull, they will contract, and that's how you get your hip flexion. Right, so these are the muscles that's contributing to your hip flexor or hip flexion movement. Right now, over here, this is where you want to find your hip bone. Basically, the landmark that you want to find is basically this protruding area of your hip. Okay, it does tell a lot of different whether you are on the upside of your hip or you're on the downside of the hip. So this is the landmark. When we talk about finding the muscles, where your thumb is basically will help you locate different part of the muscle. Alright, so with this as your landmark, when you are on the upside, this area is where you will find your iliacus. Okay, of course, if you look at the 3D model, it actually goes deep. This muscle over here, you will basically find it sore, and you can actually find it tight if it's really the hip flexor that is giving you, or part of the hip flexor that is giving you the problem. So this is how you want to locate on the upside of it. Okay, and for the rectus, for your rectus femoris, which is part of your quads muscle, and some of the other stabilizing muscle, it actually starts or actually originate from the downside of your hip. So if you were to go slightly lower, you will see that, or you will actually find that, so hip bone again, this area is another muscle that could possibly give you some soreness if it's coming from your hip flexors. Okay, so when we flex our hip, you will find that this muscle works. Okay, and these guys have to come in and work because the hip flexor, the original hip flexor muscles are not that strong. So these guys kind of come in as the hip flexor muscles now as well because of the motion. Okay, at different range, the muscle will try to come in and do the work, and in this case, it will be your quads. Just beside your quadriceps muscle, rectus femoris specifically, the one that is just beside is basically your sartorius. So if you roll around, you will realize that the sartorius is also kind of tender if it's your hip flexor group muscle that's giving you the pain. So that's how you want to locate. First thing, just to recap, your hip bone, and whether you are up or whether you are down. Okay, so up here, this is your iliacus. Down, you have your rectus femoris and your sartorius. You want to roll around, you will feel that there's actually different bands of muscle around here. So there you go. I hope you have a better understanding of your hip flexor group muscle now, because if you are able to locate them and you know what's going on, what are the muscles around there, it helps you better understand what you're supposed to do when it's really your hip flexor. And that's how you want to locate and find out which exact muscle is actually the one that's giving you the problem. In my next video, I will show you how you can actually relieve this muscle, the different ways that I help my patients to relieve them, and these are some of the things that you can actually help yourself when you're at home. But that's something that you need to be cautious about because not many people will be able to do them. So in my next video, I'll cover them and you may want to learn them as well. That's really all I have for you in this video. So if you haven't clicked on the subscription button or you haven't clicked on the bell button, do so, because then you will not miss any video that I post in the future. And if you like this video, don't forget to click on the like. This way, YouTube will actually help people who are understanding their hip or wants to understand their hip, wants to find out about their hip, to also see this video based on their algorithm. Alright, so that's it. Please take care and I will see you soon. Bye bye.